and then to be told, I'm sorry, we can't see you, we're going to put you on a waiting list, is probably pretty devastating for some families. And you hope that nothing serious happens between the time the family calls and the time the family does see you.
If something serious does happen, well, you can guess where the child ends up.
We are at a desperate shortage of qualified clinicians, of psychiatrists, of psychologists, of mental health workers. Finding qualified individuals to do this work is very hard.
It took Dr. Custrin 5 months to hire a psychologist, and many times the clinicians she hires don't have much experience because the pay is so low.
We have been understaffed from the time that I've been here. I've worked at other agencies where we're always understaffed.
And underpaid. Part of the problem with funding levels for these clinics, and for most mental health professionals, insurance and Medicaid only pay out for time spent with the actual patient.
Our reimbursement gets whittled down by denials of payment by managed care organizations.
13-year-old Emily Nelson's mental illness took her mother on an agonizing journey through the pitfalls of managed care.
I was sitting there stunned, stunned at the system and the helplessness of doctors and physicians and psychiatrists who are educated, powerlessness against an insurance company who is somewhere miles away, who has not ever met my daughter, and the only thing they know is that I'm draining money from their financial till.
To fully appreciate Ann Nelson's exasperation with her health insurer, you need to understand her anguish as a parent, forced to accept a shocking diagnosis before Emily even made it to 2nd grade.
When we first put her on Ritalin, it was awful. I grieve the fact that I have the only 4-year-old child in the shoreline of Connecticut on Ritalin. And I think with each med, there's a new diagnosis. So, you start off with Ritalin and, oh, well, I have a kid with ADHD. So, okay, I guess I can deal with having a child with that. And then it's depression. You think, gosh, geez, I don't think I know anybody who ever had a child with depression. Or did my mother have depression? You start to sort of look back and not only who is your child, but who are you and who is your family. And then I think the worst thing, which was a horrible grief for me, was when it escalates to maybe it's bipolar disorder.
And that was the diagnosis, bipolar disorder, at age 7.
And it was awful. It was absolutely awful because, yeah, there's meds, there's choices, but I think the hardest thing for me was I have a mentally ill child,
Ann is a nurse, her husband Kelly a doctor. They bought the best insurance coverage money could buy.
I pay a business $1,200, $1,500 a month to receive a service, which is the best psychiatric care for my daughter. That's what I was told on their contract. You will get inpatient hospitalization.
But in her time of crisis, a Sunday night when Emily started to hallucinate and was rushed to the emergency room, her daughter was denied coverage for inpatient hospitalization, even though doctors fought to admit her.
And they said, your insurance company just called back and they're not going to cover her admission to St. Raphael's. And I said, well, why is that? And they said, they don't believe it's medically necessary and she doesn't meet the clinical criteria.
At this stage of Emily's illness, she'd already been hospitalized twice for psychotic breakdowns, and she was on multiple medications.
And I said, well, all right, if they don't give the authorization number, I said, I'm not rich, but I can write you a check. We're blessed in that at least we have some money in the bank. Can I write you a check for $10,000 or $20,000? Whatever it takes to get my daughter tucked into a bed tonight on a Sunday night so that we can deal with this issue tomorrow. It's Monday. No, we can't do that. And I said, so you mean to tell me that the only ticket to getting Emily a bed in an appropriate child psychiatric hospital in this state is some 5-digit number from Value Options? They said, absolutely, that's what it is.
Denied and desperate, Ann turned to the Department of Children and Families Voluntary Services Program.
This hospitalization, which was about $50,000, our state of Connecticut paid that bill. My insurance company did not. When you're talking about a family like ours sucking money out of our state to pay for a child, I find it sick. I find it absolutely sick.
Ann's daughter was denied care capriciously.
Maureen Smith is Connecticut's healthcare advocate. Every formal complaint about health insurance and managed care comes across her desk. The highest percentage of those complaints involves mental health.
We've been trending these issues for 3 or 4 years now, and it is getting worse as time goes on. I get the stories of my child's been in an emergency room for 5 days. She has tried to commit suicide. The hospital doesn't have a mental health unit, and so we're waiting for a bed to open up.
Smith gets the calls about the shortage of mental health providers, therapists, psychologists, psychiatrists.
Patients are calling and saying, I called 10 people in my area that are in the directory, and all of them have dropped out.
She also hears from providers who complain about the insurers.
We've had it. Our reimbursement rates are low. We have more than enough paperwork that overwhelms us. We get micromanaged.
Some even drop out, refusing to take insurance and requiring patients to pay out of pocket. But her top priority is denial of coverage, like in the case of Emily Nelson.
I would describe it as being in a state of crisis.
A crisis so severe that Connecticut's Attorney General Richard Blumenthal is investigating.
We have encountered repeatedly examples of children being denied medical care to their very severe and lasting detriment. We're going through those records, the computerized records that are kept by our Department of Social Services, to determine whether the private insurers are refusing to pay for medical treatment and thereby shifting the costs to our state government and our taxpayers, which would be a violation of their contracts and the public trust. The cost potentially is in the tens of millions of dollars, maybe hundreds of millions of dollars. Whatever the precise figure, it is a huge issue, financially and in human terms.
I couldn't disagree with that more.
Lobbyist Keith Stover represents every insurance company in the state except Anthem Blue Cross Blue Shield. He's the closest we could get to the insurance industry, and he's frustrated with the Attorney General's accusations.
The frustration you hear from me is very simply people making a broad pronouncement that the industry is shifting costs to the state and it's potentially costing the state tens of billions of dollars without any data to back that up. That's nonsense. It's not fair, and it's not accurate. It would probably cost more to develop a scheme like that and implement it than it would to pay for care. That's silly.
It's a strategy known to Blumenthal as cost shifting, and he and child advocate Jeannie Milstein take it very seriously.
The rules that can be enforced here could apply not only civil remedies with recoveries of money, but also possibly criminal sanctions, because if there is purposeful and intentional cost shifting by these agencies, it could be a fraud on the federal or state governments.
Blumenthal was instrumental in changing Connecticut's mental health laws, which required insurers to provide the same level of coverage and the same co-payments for mental illness as they do for physical illness.
It is a very expensive area. Payers have experienced a significant increase in the amount of money that they're paying for mental health care services since the passage of that law.
But as Ann Nelson experienced, and Maureen Smith hears all the time, managed care companies make the final call on whether a patient's symptoms qualify them for coverage.
The symptoms are so vague. Yells at mother, hits sister, runs away from school bus. They can argue that those aren't medical symptoms.
The thing that makes it more challenging on the mental health side is that diabetes is much easier to identify. You can draw blood tests, you can see results. With bipolar, it's not that clear and it's not that distinct.
A psychiatric disorder is more mysterious and mystifying, perhaps harder to understand, because it is not a sort of physically visible malady. Its effects may be physically visible, but the disorder or dysfunction is perhaps more difficult to diagnose in layman's terms. So the cost shifting may be more easily explicable by the insurer, or the denial of treatment may be harder to hold an insurer accountable.
Translation, there's a lot of gray area. Stover says that's where mental health providers take the blame.
And frankly, that provider community needs to get its act together in collecting data about what works best, because there is precious little of that sort of activity going on, as there are in all other modalities of the healthcare delivery system. It is a real problem.
A few years ago, the American Diabetes Association came out with a treatment guide for patients with diabetes. This gave private insurers and payers a guideline to set reimbursement rates. Many believe this type of guide is critical to improving the mental health care system.
Until that provider community gets its arms around what works, what doesn't, the same way that cardiologists have and the same way that gerontologists have and pediatricians have, this is going to continue to be a problem.
In Blumenthal's opinion, health insurers' bottom line compounds this problem.
Cost control and cost cutting have become a mantra in this industry. And perhaps there are good and sound ways to control costs, but not on the backs of young people who suffer from very severe illnesses or disorders.
I don't like the way I act and do things sometimes. I wish I could have gone to school and done a lot of things.
This letter from the Manson Youth Prison is the last one Diana Gonzalez received from her 17-year-old son David before he killed himself in his cell.
I love you. Bye. Right back. He kept saying right back.
David Burgos, lonely and distraught, sent to prison on charges he violated probation for possession of a BB gun.
I don't know if he was under medication. I still don't know.
Diana Gonzalez can't help but wonder, was her son's real crime mental illness?
Here's a kid that's got troubles, got mental illness, and they expected that kid to stay put in without running away? I'm saying, I don't understand that.
David's trouble started when he was in 2nd grade. The school complained he couldn't sit still and was easily distracted. Diagnosis, ADHD, attention deficit and hyperactivity disorder. Diana says she was in an abusive relationship around that time and had trouble taking care of David and his 3 siblings. Department of Children and Families stepped in and removed the 3 youngest. David was 10.
Because I thought he would be in a better place, that he would get the help that he needed. Because I couldn't provide for everything that he needed.
Later came the bipolar disorder diagnosis, a 1.5 years spent at Riverview, Connecticut Psychiatric Hospital for Children, and then bouts at group homes.
David kept running away from them, running away, and it's like he said, they don't understand me, they don't know nothing, I don't like them. I mean, he was talking negative all the way. The last time I saw him that he kept running away was in March. And he came here and said, baby, you got a court date, you need to go to it.
Then came this letter in the mail, informing Diana her son was now in prison. How alone do you think he felt there?
How alone?
Alone.
To tell you the truth, so alone that I couldn't even comprehend it. The most that I can take in to comprehending will be never compared to what he probably felt.
Along with photographs of David's happier days.
And these are all the articles that I've been collecting.
Diana keeps a scrapbook about his death.
David was not a criminal. How many other kids in there are not criminals?
20% of inmates in Connecticut's prisons have significant mental health needs, more than triple that when you talk about the state's juvenile justice system, statistics that follow the national trend.
It's probably the most significant challenge that faces people in the system right now.
William Carbone oversees all of Connecticut's court support services for the judicial branch. That includes juvenile probation and detention. He estimates about 70% of the kids that wind up in detention need mental health services.
You now have full-time nursing in all the detention centers because there are so many children who are on psychotropic medications. In all the detention centers, you now have weekly services of a psychiatrist available. You have daily, for 10, 12 hours per day, mental health clinicians in the centers that can work directly with children.
Connecticut started adding these resources in the late 90s after a federal court ordered the state to improve mental health services for kids in its juvenile justice system.
The mental health problem can be clearly identified as the source of the criminal behavior. So you can't simply respond to the crime that's been committed, because if you do that and don't respond to the mental health problem, you have a child that's going to keep coming back into the system.
If you have interest, we'll work on ways to get you into some of those programs.
Activists Merva Jackson and Beresford Wilson are trying to do that one better, catch the kid with mental health problems before they get trapped in the system.
We started to see an overwhelming number of young people with mental health, learning disability, and other needs coming to our office, their parents saying, you know, my kid was just suspended or expelled from school and sent to juvenile court. And we were like, well, why? This is what we're proposing, and I have some of the same concerns. But
after a few years of hard lobbying, their organization, called AFCAMP, received a state grant to start a juvenile review board in 2 of Hartford's neighborhoods. How does it work?
Well, I got in trouble in a school bus in a fight.
First-time offenders like Dalby Dupre, who get in trouble at school or with police, get referred to Merva Jackson through the courts.
They gave me like a psychiatrist or something. I don't know, like somebody I could talk to, like sort out my problems and all that.
Through our program, they can access mental health and counseling services at a quicker pace than they would be able to through other entities.
Like she helps me. Like,
it's not just about not getting a record and not ended up in juvenile, but it's also identifying what their needs are, whether it's academic, whether it's mental health, whether it's environmental.
Una rutina y le hacen cosas. They give him a routine to do that they don't want him on the streets. They give him stuff to do, keep him active from not being on the street.
The review board, a huge relief for Dalby's father, who was sure his son was headed to jail.
My dad was crying. Like, he felt sad. Like damn, my son gonna go get locked up.
Well, this is having that resource right there at the crisis point. Being preventative, interventive, and responsive.
In 2005, the first full year of its operation, the Hartford Juvenile Review Board diverted 250 kids from the court system. The cost, $100,000. The same amount it cost to keep one child in detention for a year. Saving money, saving lives. A critical safety net that was not available to David Burgos and many others like him.
You know, sometimes it takes a tragedy for you to realize it. You know, the things that maybe you could have done. I don't want nobody to feel the same pain.
There are real pockets of progress in the fight to improve children's mental health care. Connecticut and other states are looking beyond their borders for answers. 2 programs have gained a national reputation for leading the way, and they share the same philosophy that kids do best when they're treated close to home.
Mary Jo Myers is one of the architects of Milwaukee's nationally renowned child welfare program, Wraparound Milwaukee, which has saved the state of Wisconsin millions of dollars in the 10 years it's been up and running.
We've taken the same amount of money that used to be just for kids in residential care, and we use that same amount of money to serve now 600 kids, where before you could only serve 350 or so.
She held a training session in Hartford for everyone from social workers to probation officers to parents.
What just happened?
Providing tools to keep kids with emotional and mental health problems out of jail and institutions.
And as soon as you start looking at strengths, it changes everything. People begin to have hope. They see that you believe in them. They look at their children differently.
Myers says the key is involving parents in their child's therapy.
So families come forward and feel like they can say what they need without someone taking their child away.
Connecticut's Court Support Services Division is adopting this strategy.
These are complex children, typically from complex families. And unless we address the larger family issues, that child is likely to keep coming back into the system.
Many times with disastrous results.
I could not bear managing the patients the way we were managing them. I thought it was a disgrace.
On the medical side, a similar philosophy at the Morgan Stanley Children's Hospital of New York Presbyterian, where Director of Psychiatry Dr. Jennifer Havens helped revamp and revolutionize emergency protocol for young psychiatric patients.
When you're building one of these units, you have to build it to inpatient psych standards, which is totally different than a medical ER. We had to cover this window. Obviously, you don't want a window in a psych unit.
Creating an emergency treatment center designed solely for kids in mental distress. Tucked away on one of the hospital's top floors.
The expanded design has a lot more space. Our ER is extraordinarily busy. It's very loud. It's very stimulating. It's very frightening. 50,000 patients a year, sometimes 100 patients an hour.
It's totally an unsafe environment for a patient who is in a position where they might hurt themselves.
Who's that?
21 hours, is that true?
No. Dr. Meredith Sonnet runs the Children's Emergency Department at New York Presbyterian. Before the Child Psychiatric Emergency Program opened 2.5 years ago, she and Dr. Havens would often argue about how some of the young patients were treated in the ER.
In a busy emergency department environment, you're much more apt as a physician caring for a patient who's agitated or requiring psych intervention to use medications to calm them down, where that in fact may not be the best treatment for them.
That doesn't happen anymore. Now any child or adolescent presenting with psychiatric symptoms is transferred up to Dr. Havens and her staff. Last year, that was 1,100 kids diverted from the ER.
This has really just had a tremendously positive impact on our ability to take care of the kids and how we feel about ourselves as physicians and healthcare workers.
Dr. Havens has testified about her hospital's success before Connecticut's legislature, which is in the process of funding a similar center to address the crisis in the state's emergency rooms. Her innovative program, however, goes way beyond the hospital's doors. She's managed to treat patients in their communities, dropping hospital and residential admissions by 35%. And she's gone grassroots.
We're in 14 elementary schools providing service. We've put psychiatry and psychology in all the pediatric clinics we have out in the community. If you don't treat mental illness early, particularly when it disrupts school functioning, which it does, kids fail. And they become, disenfranchised, angry, depressed teenagers. We can't just sit and let these kids just go through life, struggling with this when we know what to do.
This program brought to you by the generous support of the Connecticut Health Foundation, dedicated to improving the health of the people of Connecticut, Toyota Financial Services, the William Casper Graustein Memorial Fund, and Families United for Children's Mental Health. For more information or to purchase a copy of this program, please contact our website at www.danalis.com.